And after 10 years of not smoking, you're almost as good as somebody who never smoked in life. So imagine the positive effects of it. And the other biggest thing that I always tell my patients is the amount of money you save. If you are spending 20 pounds a week on cigarettes, imagine how much you save over a year. Or imagine how much you would save after 10 years. You can actually buy a house.
Welcome back, viewers, to Faith and Discipline podcast. It comes under smoking umbrella. Is it just cigarettes? Because nowadays people are moving away from cigarettes, some of it, not all of them, and they start smoking vapes. Are these safe?
Again, it's not a controversial question, but it's a very common question that gets asked, because smoking doesn't just involve smoking cigarettes. Vaping comes under it. Lots of drugs that they can smoke comes under it, and therefore it's a huge umbrella term. What I can tell you is smoking cannot be replaced with vaping. On no terms we can say you can start vaping, because there's no evidence, there's no clear evidence to say vaping is safe. However, people have used it as a habit to come off smoking over a period of time. But smoking is even if you're still vaping, it is still detrimental. Not just, again, as I said, medically, but financially as well.
Okay.
And therefore, I think it's important, we don't have enough data to say vaping is safe, so carry on vaping. There's a very nice paper which has actually come out from American studies to say people have used vaping as a habit to come off smoking. But you should not start vaping as a habit, because that will lead you into smoking cigarettes.
Okay.
And that's very important.
And like some of the states in America and other parts of the world, they have bans vaping. They believe some of the chemicals in the vapes are not safe, and there might be harmful chemicals in it. What's your opinion on that?
Very true. I think that's where I was coming from, to say vaping has shown that there is some lung injury that can happen.
Okay.
And therefore, we don't recommend people to go for vaping. The other thing to remember is vaping also is about getting those vapes from very regulated shops, because some shops will sell you vapes which may not be regulated. So therefore, how do you decide which vape has what concentration of nicotine in it, and is it strictly regulated? In our country, in UK, it's a difficult topic, because nobody can fully monitor what is the nicotine content in the vapes, and therefore it is still considered as harmful.
Other than cigarettes and vape, some people smoke some traditional stuff. In Middle East, they smoke it's called shisha. There are some shisha bars in this country as well. And traditionally in South Asia and some African countries, they smoke, it's called water pipe, or it's called hookah. And they believe it's very, very safe. What is your opinion on that?
Again, very difficult question, but I think irrespective of what you smoke, I think there's harmful effects. The problem with some of these things is we don't have a strong research evidence behind it, and therefore we cannot say it is safe. And I think it has to be considered unsafe until proven otherwise. And therefore I would strongly recommend staying off it, because it does develop the habit that you can do these things. Therefore it takes you to the next level of bad lifestyle measures. Therefore it is still not recommended.
I think I've seen a study on hookah. Some of the South Asian doctors, that they've done a study on hookah as well, and they believe it is harmful. If I find the study, I'll forward it on to you.
It'd be great to look at that study, because I'm sure nobody in medical field would suggest you should carry on with hookah.
Exactly. Let's talk about the diseases that are associated with smoking and how serious they can be.
Like I said in the first half of the session, where I suggested how smoking can actually affect every organ of the body. The big one with the smoking is what damage it causes on the lungs. So people actually develop what's called as COPD as part of the smoking. That's the biggest culprit. The next big one is heart issues. So people can develop heart attacks. That is another big one. The other biggest one is actually cancers, which is the biggest culprit behind cancer is smoking. So therefore, it is important to understand there are some really big diseases that can happen with smoking. So people can develop lung cancers, people can develop oral cancers, people can develop any cancer of the body with smoking being the biggest risk factor. And like I said, heart attacks, strokes are very common in people who smoke. People with smoking history can actually also develop what we call as peripheral vascular disease, meaning disease that affects the vessels of the body, and more so the legs and the hands, where then there is a narrowing of arteries, narrowing of the vessels, causing huge problems. So all in all, the smoking is a slow killer. It works in the background and you only realize when it hits you very hard with a problem. So therefore, it is causing damage continuously and slowly over years.
In my observation, everyone who smokes, the voice is slightly different, a bit hoarse voice, and they often cough when they speak. Some of them even can't complete their sentence, and they have to breathe, take a deep breath, and then they have to cough. And a lot of people they produce phlegm as well. So if they have that type of symptoms, are they okay to carry on smoking until they end up in A&E, or do they need to see a GP?
Yeah. So I think I'll elaborate a little bit more about what symptoms can you get when people smoke. Obviously, people can become, like you rightly said, can have a very hoarse voice. They have a cough with phlegm. People can become very breathless. That's one of the commonest symptoms. People can develop chest pains. People can start losing weight. People can start coughing up blood. People can start getting chest pains, body aches, lots of symptoms. Obviously, we don't want people to develop those symptoms and then go and see the doctor. Prevention is always better. Smoking cessation, therefore prevention is always better. However, if you develop the symptoms, the first thing is to actually seek the help of doctor. But more importantly, stop smoking. Now, very interestingly, when you stop smoking, people actually experience that the symptoms get a little bit worse in the first few weeks.
Okay.
And that's important to appreciate, because a lot of patients come and tell us to say, since I stopped smoking, I've developed these problems. But actually, over a period of time, people will get better. It's just that perseverance. Now, people should seek help from the doctor, because what you will need is, if you have any of these symptoms, you will need some further investigations. You might need an X-ray. You might need some blood tests. You might need some puffing and blowing tests. So we do these things in people who have significant smoking history and have developed symptoms. You might need some further investigations to look at your heart. So there are things that can be done. And of course, like I said at the beginning, the most important thing is to help and support these people and say, if you stop, you will be like a normal person after a few years. And we can support you with support psychologically and also with medications. I think that's important to emphasize. It is not to make them feel horrible. We need to make them feel comfortable.
Yes, because some of the people, they've tried to stop smoking, but then they start again. Is it due to they have like not very strong willpower?
I think it's a combination.
Yeah.
Because I think it's a combination of willpower, peer group, and not seeing the effect of smoking, cessation. But there is another category of patients who I would want to highlight is, I think it's important to make people understand that if you don't smoke, usually the effects of not smoking starts to work on your body straight away. Within 20 minutes, your heart rate starts coming down. Within an hour, your exercise gets better. Within a few years, you'll feel much better. And after 10 years of not smoking, you're almost as good as somebody who never smoked in life. So imagine the positive effects of it. And the other biggest thing that I always tell my patients is the amount of money you save. If you're spending 20 pounds a week on cigarettes, imagine how much you save over a year. Or imagine how much you would save after 10 years. You can actually buy a house with that money. So it's a massive financial benefit, not just health benefit. So there is a lot of positives in it.
That's really good advice, a really good point. To sum up, what are your recommendations you would like to share with the viewers of this podcast?
One thing is to understand smoking is not just a habit, it's a disease. So therefore, we need to treat the disease. Two big things that we can do: help you with medications, help you with support. Other big thing to remember: if you develop any symptoms, stop smoking, get advice from the doctor. We can help you. And people come back and say, I've stopped smoking, and it spreads like wildfire to stop more people stop smoking. So I think take it positively, you can do it, and it is possible.
At the end, I want to ask a question. Like, some people think about it and they talk in the social gatherings. It's like a myth. Some people, they carry on smoking in their 80s and maybe 90s, and they've been smoking all their life. And people point out to them and say, look at that guy. He's been smoking all his life and he's fit and well, nothing wrong with him. So it's not smoking, it's just the bad media. So what's your opinion on that?
See, if you want to stop a bad habit, there's no time to it. You got to stop it. We know it's bad. So there's no need to prove it is bad. It doesn't matter now, later, at the age of 80 or 90. It's never too late to stop smoking. So I think there's always going to be a positive benefit to it. So that's my message. And I think it's important that we don't pass on this bad habit to our families, but more importantly to the children, because that's where we need to focus on. It's crucial that the children don't get into the habit of smoking, and that is what translates in the later part of their life. So we need to be mindful that people around us will be watching. So if it's 80-year-old, 90-year-old, even more important, because your grandchildren will be watching that you're smoking. So I think there's no age limit to it.
Yeah, that's true. But maybe, statistically, maybe 1 in 1,000 people, or maybe one in 100,000 people, the guy is smoking and he is not like too much affected by it. It doesn't mean like we should take the bad inspiration from.
Absolutely. That's the main thing.
So, final question. We talked about smoking, but some people go to next level and they indulge themselves into drugs. So, like some people smoke, it's called cannabis, some people call it weed. In America, they call it marijuana. So, these type of things. What is your opinion on that?
See, these patients or these people, unfortunately, for lack of support and very valid financial reasons or family reasons, end up in these situations. Interestingly, these people also smoke cigarettes with it. So when you have something with smoking, especially cannabis or the weed or marijuana, the harmful effects actually multiply. It's not double. It can go exponentially high. And fundamentally, these affect the lungs and the heart. If you are breathless with every breath you take because of the side effects of these problems, the simplest and the best thing to do is actually not do it. Therefore, it's got huge side effects, huge problems, and it adds to more problems. So therefore, a strong recommendation, you have to come off it. And we should support you with it.
Thank you very much, Dr. Mehdi. I believe our viewers have found advice and all the knowledge very helpful. Thanks for coming.
Thank you. My pleasure, and thank you very much.
Thanks, viewer, for watching this episode. If you found this useful, you can share with your family and friends. And if you haven't already, please make sure to subscribe to this channel. Thank you very much.